Dr. David Kulla here with Synergy Wellness in New York City. Today we have Erica here who has a torn rotator cuff muscle. She actually has two tears, one in the supraspinatus muscle and one in the infraspinatus muscle. And both of the muscles lay right next to each other. So when you have a torn rotator cuff muscle, first of all, the rotator cuff muscles, a lot of people think they have everything to do with the motion in the shoulder. They're really not the main mover of the shoulder. The rotator cuff muscles are really meant to stabilize the shoulder joint and to keep the arm into the socket and stabilize that whole shoulder joint. So that's what rotator cuff muscles are for, stabilization. Now, her supraspinatus is torn as well as the infraspinatus, as I said before. The supraspinatus, when we're sitting at our desk on a computer, and the second we bring our elbow away from our body like this, 10 degrees, just like that, we're contracting that supraspinatus muscle. So if you're on a computer all day and your elbow's out like this on the keyboard, no good. You're going to get really tight supraspinatus, or you're going to get tendonitis in the supraspinatus muscle. So we're going to go ahead and really the only thing for a torn rotator cuff muscle besides surgery, which is not effective, develops a lot of scar tissue, there's a lot of side effects to that. This right here, cold laser therapy, can help heal and repair soft tissue damage and tears. So there's nothing else that does it quite like this. This is a very, very unique machine. And what we're going to start off with is she's having pain in her shoulder and limited range of motion. So what I'm going to have you do is raise your arm up, show me where it was limited.
Oh,
right there it hurts, or go stop, lower it down, and I want you to stop where it hurts. And so start from the beginning. So yep, and raise it up and stop when it hurts. Right there?
Yes.
Okay. So right below her ear line, you can see there. So we're going to go ahead and laser her and check her range of motion after. And what I'm going to do is, this particular laser can scan the soft tissue for areas of soft tissue damage and inflammation. You'll hear it beep. And I'm just going to run over both the supraspinatus and infraspinatus muscle. And you heard a beep there. I'm going to run over it again, make sure that wasn't a false alarm. And it was not. Okay. So it's actually going to tell me, this particular laser is going to tell me how long to dose the area for. And it's a unique laser in the sense that it can find areas of inflammation and soft tissue damage like a stud finder. And it works, it's uncanny. I mean, it works perfectly. I'm assuming you have pain right here too, right where the laser is. Yeah. And typically about 10 to 15 sessions will heal and repair the tears. Sometimes in a difficult case, we might have to do a second round of 10 to 15 laser sessions. And that usually fixes this issue. Her tears are not bad. They're worse in the supraspinatus muscle than they are in the infraspinatus muscle. And there we go. You heard it beep again. So again, we're going to run it right alongside the supraspinatus and infraspinatus. Now, right now I'm over the infraspinatus. And actually, last time we lasered her knee, she has a little bit of tendonitis in the knee, and we did one laser treatment, and you're doing pretty well after that treatment, right?
Yeah, we did a couple of sessions. It was great.
Yeah, okay, that's right, a couple sessions. Really great for tendonitis, muscle tears, tendon tears. Anytime you've had surgery and you want to break up scar tissue, hands down, cold laser therapy is the best thing for any of those soft tissue injuries. It's non-invasive, so it's safe, it's non-invasive. It's kind of a no-brainer. If you have a soft tissue injury, you should consider getting cold laser therapy done. You know, as long as it's not a muscle that's deep inside the body that you can't reach to. Like somebody had asked me if they can do cold laser therapy on their diaphragm. You can't, because the diaphragm is much deeper in there. And unfortunately, you cannot do that. So, how are you feeling right now?
I'm great.
Yeah, and the other nice thing is you don't feel anything with the laser therapy.
Yeah.
It's painless, and as we do more and more sessions, we change the frequencies to penetrate deeper into the tissue and have a different physiological effect. So right now what I'm doing is inhibiting, so reducing muscle spasms, inhibiting any nerve pain, inflammation. So this will give her some pain relief, but after a couple of treatments, we start going deeper with the laser, changing the frequency, and starting the healing and repairing process. We don't want to do that right away because that can stir up a little inflammation and cause a little irritation on her first treatment of the shoulder. So again, after 3 or 4 treatments, when the pain reduces, that's when we start going deeper, penetrating deeper into the tissue with the laser. And instead of focusing on pain and inflammation, we're now focusing on inflammation and tissue healing and repairing. And there we go, it dosed that infraspinatus. I'm gonna run it up here along the supraspinatus again. Make sure we got every spot, and we clearly didn't. Okay. And I don't know of any other lasers that find the areas of inflammation and soft tissue damage. Now granted, I know where she has damage because I have an MRI of her shoulder and I know exactly which muscles are torn and where in the muscle we have the tears. But I like to use this just to see that it's working properly. And it has so far worked great. It's beeped over all the areas that she has tears. And then we're going to check her range of motion afterwards. One last spot here. Does it hurt for you to reach across your body?
Yes.
Okay. So as I was saying before, the rotator cuff muscles are really meant to stabilize the shoulder, hold the shoulder impact, into the shoulder girdle and the joint. The main mover of the shoulder joint is the subscapularis muscle, not the rotator cuff muscle, for those of you that are wondering. But when you get rotator cuff tears, it can cause a lot of pain, stiffness, and a reduced mobility in the shoulder itself. So we're going to check her mobility, her range of motion here in just a second. Okay, go ahead and raise your arm for me. Stop when you have pain.
Right there is good.
Right there, okay. So she's going a little bit higher, maybe an extra 10, 15 degrees higher. You can go ahead and lower your arm. That's only our first treatment. We're obviously going to follow up with 10 to 15 sessions of laser therapy over the tears to heal and repair the muscles in a straight fashion rather than them healing crisscrossed like scar tissue. So thanks for tuning in. If you guys have any questions, feel free to comment below. And thanks for tuning in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.